Okay, this is for doctors, for future, for whatever. So that's Ben. He doesn't want to go to hospital. What will push it back up is some salt and vinegar crisps or peanuts, and that's what I'm giving him at the moment. We've spoken to doctors, spoken to surgeons, spoken to consultants, and it's been what? How long's this been going on for, Ben?
November.
Yeah, November, since the big time started, and his stomach, right, considering he's not eating, is huge. He's having acid reflux. He's got bowel issues. He's got every issue going, and yet they're trying to now say it might be irritable bowel syndrome. Well, a doctor told me last year it's not irritable bowel syndrome. He took a blood test and had that confirmed. So, to be fair, I don't know what the hell is going on with our NHS, but I'm disgusted in it because my son, I'm watching, withering away, getting tinier and smaller and smaller and smaller and smaller because nobody knows what's wrong with him. Yeah, and the NHS, the ICB, integrated board for the NHS who give care. He's got his mask off him because he needs to eat. This is how difficult this care is. Saying that he's not entitled to complex care because he's not complex. Well, that's what saying this isn't complex. What would a carer do? What would a carer do right now? Because that's what I would like to know. Rather than at least the nurse would know what they're doing. Me, I'm not qualified. They keep telling me that. I'm more qualified than them. I believe in my own brain. My brain works better than theirs. I don't believe what the hell's going on with my son. Why I keep having to get him into bed, put enemas up his backside, or everything else that I have to keep doing with the bowels. And Ben's issues, he was born with a congenital diaphragmatic hernia. The diaphragm is intact, so the Gore-Tex patch is still intact. So it's not the diaphragm. We've had the colon checked, even for cancer. It's not that. So what is it when I've told them he's got scoliosis and it's a spinal cord injury on top of the diaphragmatic hernia? So why aren't they looking at the larger big bowel? Like, why are they saying IBS to Ben when I don't get it? And they've actually put it down on record to state that Mum thinks it's this. Well, I think it's a lot of things that we need to eliminate and get him into hospital. That's what I think. And now tomorrow, he's got to have a paramedic come to the house to take bloods because my son don't have any veins because he's had that many operations and he's got no veins. They have to take it from the ankle. I am one frustrated. England is useless. I'm pissed off and I'm getting sick of watching my son day in, day out, poorly. And me having to do 24/7 care and being in prison for that because they've locked me and my son away for 5 years now without giving us the care. And it's disgusting. That's Britain for you. Never mind whoever's coming over on the boats and no border control, correct this, correct that, and want to put money into the country for weapons and for other countries and not, you know what, you're not even looking after this country. This country needs looking after, not just the NHS, pharmaceuticals, pharmacies. What about our elderly? What about all our hospitals? What about all the care sectors? What about everything, actually, and the crappy policies? What about the justice system? Because this is, I don't know what's wrong with my son, but this is because I need justice back on the NHS because of what they've done to him. It's disgusting. And they know I've been fighting for 26 years, the justice system. And blacklisting me is no good. I'm fed up with it. Look at the state of my son. Stay there, stay still while I get a reading. You alright?
Yeah.
No, stay still.
I am.
I tell you what, no parent, mother or family should go through this. No one. No one should be going through this. No one should be in pain. So we get told today, you know, a spinal injury is going to be able to feel his bowel. He's never felt. He's a spinal injury. I don't get these people. I've got to get off this video after I've done his blood pressure. Once I've done that and I know it's okay, or it's going back up. How bad is this at home? Look at this. This is gonna have to. I don't know what else to do. I'm gonna put him on the ventilator, get him off this. I've got to stop the video. This is pissing me off.